Our brain generates what we experience. Our brain will make up what we see, it will generate and make up what we hear, and it will create what we feel. And it's so important to understand this. So important. Because when you touch a hot stove, it's not your finger causing pain, it's the brain. That is a revolutionary thing to say, and it's true from a neuroscience point of view. How do we know that? Simply because you can have an injury and have no pain. It's been documented thousands of times. People have had nails in their hands, nails in their face, severe injuries, and a lot of people have experienced that themselves. It doesn't happen all the time, obviously, because when you get an injury, your brain is supposed to turn on pain to warn you that there's danger. If you break an ankle, you want pain. Your brain will create that pain in order to tell you not to walk on that ankle. And you can have pain in the absence of injury, and this has been documented thousands of times, and that's what we do. The vast majority of people with chronic pain have neuroplastic pain condition, 90% roughly 90%. And that's true for neuroplastic conditions and chronic fatigue and anxiety and depression and many other conditions like POTS, MCAS, etc. So what we're saying is that it is critical to really deeply understand that our brain is creating these sensations. And when structural damage has been ruled out, which is usually easy to do by going to regular doctors, when structural damage has been ruled out, then we can assume that it is neuroplastic, and we can rule that in using the criteria that I've published, that I've started making famous, called the FIT criteria. And so when I was in my 30s and 40s, I had chronic neck pain. It would come and go, come and go. It was bad. It was horrible. And then it would go away and then it would come back again. And I had no idea that I didn't know anything about neuroplastic pain at that time in my career. I was a medical school faculty and I still didn't know. And I had MRIs of my neck, and it showed bulging discs and degenerative discs. And my doctors told me my neck was damaged. I was getting old. I had arthritis. I would be in pain on and off, or maybe all the time. The rest of my life, I might need surgery. What they didn't tell me, that 50% of people in their 30s have the same exact findings I had without pain. They didn't tell me that 70% of people in their 40s have the same exact findings without pain. They didn't tell me that 80% of people in their 50s and 90% of people in their 60s have these same findings. They're normal findings that occur with age. They should not be considered to be the cause of pain without some other information which makes that true. And they didn't tell me that. And they didn't tell me that my brain could generate pain, real pain, not all in my head, not fake, not imaginary pain, real pain, because all pain is generated by the brain. All pain is real. It is critical for all of us to understand that so that we can be compassionate to ourselves and not blame ourselves for having pain or other symptoms, and not blame others for having pain or other symptoms. It's to understand people in their whole life, how they are, and what's happened to them, and what stresses or traumas, et cetera, have occurred in their life that have predisposed their brain to being more sensitive, to be more likely to turn on the danger signal of these symptoms. But the bottom line, this is a human experience, that everyone has some neuroplastic or mind-body symptoms as part of living. And they didn't tell me, they didn't ask me anything about my life, what I was going through. They didn't ask me anything about that. So it's critical to understand the power of the brain so you can really deeply feel that. So there was a woman I saw a couple years ago who had long COVID. She was suffering for about 9 or 10 months. And when she got COVID, she lost her sense of smell and taste. And that was a common symptom of COVID, right? You lose smell or taste. It's presumed to be due to its effect on the nasal mucosa and the tongue and on the receptors, et cetera, some biological issue. Anyway, her sense of smell and taste was still gone after 9 or 10 months. So I started treating her, and she understood this neuroplastic concept right away. She started getting better. I saw her 2 weeks later. Her symptoms were 70, 80% better. It was amazing. But what she told me about her sense of smell and taste was even more amazing. She told me the day after I saw her, her smell and taste returned to normal. The day after that, her smell and taste disappeared. She couldn't smell or taste that day. The next day, she could smell and taste again, and the next day it turned off. For 4 or 5 days, her sense of smell and taste was turning on and off by the day. Incredible. This seems like such an involuntary thing that's totally out of our control, whether you can smell or taste something. My goodness. But her brain had the power to turn it on and turn it off. Never underestimate the power of the brain. Do not fall into the idea that one's symptoms, whether it's pain or fatigue or anxiety, OCD, PTSD, depression, itching, burning, tingling, numbness, diarrhea, urinary problems. If it's neuroplastic, it doesn't matter how severe it is, it's still neuroplastic. If it's neuroplastic, that means the brain is producing it. That means it's potentially reversible. It's so important to really, really understand that.